Hi, my name is Tiffany Dickens. I'm an ICU charge nurse on 2 Surgical at Fairfield Medical Center. The pandemic is peaking again. Nothing seems to be changing. Surgeries are still going, others are still sick, and now we have limited bed availability, period. We are overwhelmed, and we have been for the past 19 months, and we see no end in sight. The current wave of COVID is the worst we've seen thus far. We aren't winning anymore. Our successes are less, our patients are dying, and our hearts are breaking. It's hard to bury the sight of those that have not been able to successfully leave the hospital, walk a day in the shoes of a frontline physician, ICU nurse, or a respiratory therapist. We make countless phone calls to let families know their loved ones are declining, and despite everything that we're doing, they still may not make it. We're updating families that are crying outside of a tiny window just to get a glimpse of their loved one. The look on a patient's face, knowing that they're struggling to breathe, and there's nothing more that we can do. The exhausting work that we're putting in, we're working short-staffed, pressed to the max with capacity, and the PTSD that we're living with day in and day out, it's breaking us. It's physically, mentally, and emotionally exhausting. Trying to shut it off and live a normal life outside of here doesn't exist. We worry about our team on the days that we're not here, or the patient that we cared for the day before, wondering if they're still alive. It's getting harder and harder every day. Patients are getting sicker quicker, and they're becoming younger and younger. Now imagine yourself as the COVID patient's family. Once a day, one visitor for 15 minutes, seeing your parent, spouse, sibling, or child from afar, FaceTiming them to say their goodbyes before they go on a ventilator, or they take their last breath, making the decision to withdraw care because no matter what we do, they're not going to make it. Or garbing up to sit with them for 30 minutes at the end of their life. It's very traumatic for them as well. A colleague once said, "You can choose to get vaccinated and suffer slight symptoms, or you can get COVID. And you have no idea how COVID's going to treat you. It treats everyone differently." I believe these words to be true. Mild to severe, you never know. We as an organization have pulled together, fought hard, but this fight is far from over. It's time that the community steps up to help us. We ask that you help us help you. Please wear a mask, wash your hands, social distance, and get vaccinated. We need you to join our fight.